1. A nurse is caring for an elderly patient with limited mobility. What is the most important intervention to prevent pressure ulcers in this patient? A. Frequent turning and repositioning. B. Use of a low-sodium diet. C. Encouraging increased fluid intake. D. Application of heat therapy. Answer: A. Frequent turning and repositioning. Rationale: frequent turning and repositioning reduces pressure on vulnerable areas, preventing skin breakdown. A low-sodium diet does not directly prevent pressure ulcers. Increased fluid intake helps with hydration, but is not the primary intervention. Heat therapy may cause skin damage. 2. A patient who is post-surgery is experiencing moderate pain. The nurse decides to use a non-pharmacological pain management technique. Which of the following should the nurse use first? A. Guided imagery. B. Music therapy. C. Deep breathing exercises. D. Acupressure. Answer: C. Deep breathing exercises. Rationale: deep breathing exercises are an immediate and effective non-pharmacological intervention for pain. Guided imagery and music therapy can also be beneficial, but may take more time to set up. Acupressure may also be useful, but is less commonly used in the acute setting. 3. Which of the following is the best position to promote comfort for a patient experiencing shortness of breath? A. Prone position. B. Supine with a pillow under the head. C. Semi-Fowler's position. D. Trendelenburg position. Answer: C. Semi-Fowler's position. Rationale: Semi-Fowler's position allows for easier breathing by increasing chest expansion. Prone and Trendelenburg positions are not recommended for shortness of breath. Supine with a pillow may provide some comfort, but is less effective for respiratory issues. 4. What is the primary nursing intervention when a patient is unable to perform personal hygiene due to limited mobility? A. Encourage the patient to perform hygiene independently as much as possible. B. Delegate the hygiene care to a nursing assistant immediately. C. Provide the patient with a bath in bed. D. To ensure the patient's environment is kept clean, but delay hygiene care until later. Answer: A. Encourage the patient to perform hygiene independently as much as possible. Rationale: promoting independence is essential for patient dignity and self-esteem. Delegating care is appropriate, but should not replace patient participation. Providing a bed bath is a possible intervention if necessary, but encouraging participation fosters self-care. 5. A nurse is educating a patient about sleep hygiene. Which of the following recommendations should be included? A. Limit daytime naps to no more than 30 minutes. B. Engage in stimulating activities before bedtime. C. Drink caffeinated beverages in the evening. D. Use electronic devices in bed. Answer: A. Limit daytime naps to no more than 30 minutes. Rationale: limiting naps ensures that the patient can sleep well at night. Stimulating activities, caffeine, and using electronics before bed can all interfere with sleep patterns. Napping should not exceed 30 minutes to avoid disrupting nighttime rest. 6. A patient is recovering from a hip replacement and is using a walker. What is the most important teaching point for the nurse to provide to the patient? A. Use the walker to bear all of your weight. B. Place the walker ahead of you and step forward with your weaker leg. C. Lean forward when using the walker. D. Always use the walker in a standing position. Answer: B. Place the walker ahead of you and step forward with your weaker leg. Rationale: the correct technique is to place the walker ahead, step with the weaker leg, and then follow with the stronger leg. Leaning forward or placing weight on the walker is not advised as it can cause instability. 7. A nurse is assessing a patient for signs of dehydration. Which of the following is the earliest indicator of dehydration? A. Decreased urine output. B. Increased heart rate. C. Dry mucous membranes. D. Hypotension. Answer: C. Dry mucous membranes. Rationale: dry mucous membranes are an early sign of dehydration. Decreased urine output and hypotension are later signs, while an increased heart rate may also be a compensatory mechanism, but isn't as early. 8. A patient with a nasogastric tube, NGT, is experiencing discomfort due to the tube. What is the best nursing intervention to relieve this discomfort? A. Increase the flow rate of the tube feeding. B. Secure the tube to the patient's nose with tape. C. Provide ice chips or cold water to the patient. D. Change the position of the tube frequently. Answer: B. Secure the tube to the patient's nose with tape. Rationale: securing the NGT properly helps minimize discomfort and irritation. Increasing flow rates or changing the tube's position is not a solution to discomfort. Ice chips or cold water may offer temporary relief, but do not address the cause. 9. A nurse is caring for a patient in severe pain after surgery. Which of the following should be done first to assess the patient's pain? A. Ask the patient to rate their pain on a scale of 1 to 10. B. Administer pain medication immediately. C. Observe the patient for signs of distress. D. Ask the family to rate the patient's pain. Answer: A. Ask the patient to rate their pain on a scale of 1 to 10. Rationale: the pain rating scale allows for a subjective measurement of pain from the patient's perspective. Observing signs of distress and relying on family members are not as accurate as self-reporting. 10. A nurse is caring for a patient with a pressure ulcer on the sacrum. Which of the following actions should the nurse take to promote healing? A. Massage the surrounding area to increase circulation. B. Keep the wound moist with a hydrocolloid dressing. C. Apply an alcohol-based solution to the wound. D. Use a dry gauze dressing to keep the wound dry. Answer: B. Keep the wound moist with a hydrocolloid dressing. Rationale: hydrocolloid dressings maintain a moist environment that promotes healing. Massaging the area can cause more damage, while alcohol dries out the tissue, and dry gauze may stick to the wound and cause discomfort. 11. A patient with chronic constipation is prescribed a stool softener. What should the nurse include in teaching the patient about this medication? A. Stool softeners should be used for immediate relief of constipation. B. Stool softeners should be used with a high-fiber diet. C. The medication is only effective if taken in the evening. D. The patient should avoid drinking fluids while using stool softeners. Answer: B. Stool softeners should be used with a high-fiber diet. Rationale: stool softeners work best when combined with dietary changes, such as increasing fiber intake. They provide gradual relief, not immediate. Fluids should be encouraged to help with stool passage. 12. A nurse is teaching a patient about the importance of hand hygiene. Which of the following is the most effective method to prevent infection? A. Washing hands with soap and water for at least 20 seconds. B. Using hand sanitizer with less than 60% alcohol content. C. Rinsing hands quickly with water and drying them with a towel. D. Only washing hands after using the restroom. Answer: A. Washing hands with soap and water for at least 20 seconds. Rationale: washing hands with soap and water for at least 20 seconds is the most effective method to prevent the spread of infections. Alcohol-based hand sanitizers with lower alcohol content are less effective. 13. A nurse is educating a patient on proper body mechanics for lifting objects. Which of the following should be included in the teaching? A. Bend from the waist when lifting. B. Keep the back straight and bend at the knees. C. Lift with your arms and twist your body. D. Keep your feet together when lifting. Answer: B. Keep the back straight and bend at the knees. Rationale: to prevent injury, the back should remain straight and the knees should bend while lifting. Bending at the waist or twisting the body can cause strain and injury. 14. A nurse is caring for a patient on a clear liquid diet. Which of the following foods is appropriate for this diet? A. Tomato soup. B. Apple juice. C. Creamed coffee. D. Pudding. Answer: B. Apple juice. Rationale: clear liquids include items that are transparent and do not contain solids. Apple juice fits this category, while tomato soup, creamed coffee, and pudding are not considered clear liquids. 15. A nurse is assessing a patient who is receiving opioid medication. Which of the following is a priority assessment? A. Bowel sounds. B. Respiratory rate. C. Blood pressure. D. Urine output. Answer: B. Respiratory rate. Rationale: opioid medications can depress respiratory function, so monitoring the respiratory rate is the priority. Bowel sounds are also important, but are secondary in this scenario. 16. A nurse is caring for a patient with a fever of 103 degrees Fahrenheit, 39.4 degrees Celsius. Which of the following interventions should the nurse prioritize? A. Administer acetaminophen as prescribed. B. Increase fluid intake. C. Apply cold compresses to the patient's forehead. D. Increase room temperature to help warm the patient. Answer. A. Administer acetaminophen as prescribed. Rationale. Acetaminophen is used to lower fever and provide relief. Cold compresses may help, but the first priority is addressing the fever with medication. Increasing room temperature would worsen the fever. 17. A nurse is caring for a patient who is experiencing nausea and vomiting. What is the best action for the nurse to take? A. Withhold fluids to prevent further vomiting. B. Offer clear liquids in small sips. C. Administer antiemetics immediately, without assessing. D. Encourage the patient to eat solid foods right away. Answer. B. Offer clear liquids in small sips. Rationale. Offering small sips of clear liquids can help prevent dehydration and manage nausea. Withholding fluids is not appropriate, and solid foods should not be offered until vomiting subsides. 18. A nurse is caring for a patient who is at risk for falls. Which of the following interventions is most effective in preventing falls? A. Use of a bedside table for support when walking. B. Keeping the patient in a low position in the bed. C. Installing grab bars in the bathroom. D. Providing a night light for nighttime use. Answer. C. Installing grab bars in the bathroom. Rationale. Installing grab bars in high-risk areas, such as the bathroom, is the most effective measure for preventing falls. A night light and keeping the bed in a low position are helpful, but not as effective as grab bars. 19. A nurse is caring for a patient who has been admitted for dehydration. Which of the following findings would be most concerning? A. Dark amber-colored urine. B. Increased skin turgor. C. Moist mucous membranes. D. Increased urine output. Answer. A. Dark amber-colored urine. Rationale. Dark amber urine is an indication of dehydration. Increased skin turgor and moist mucous membranes suggest good hydration. Increased urine output could be a sign of recovery or treatment, not dehydration. 20. A nurse is caring for a patient recovering from surgery who is experiencing constipation. Which of the following should be implemented first? A. Administer a laxative. B. Encourage increased fluid intake. C. Encourage ambulation. D. Increase fiber intake. Answer. C. Encourage ambulation. Rationale. Ambulation helps stimulate bowel motility, which is the first intervention for constipation. Fluids, fiber, and laxatives can follow as needed. 21. A nurse is assisting a patient with activities of daily living, ADLs. Which of the following actions promotes patient independence? A. Performing ADLs for the patient. B. Providing verbal cues to the patient only. C. Allowing the patient to perform ADLs with assistance. D. Delegating all ADLs to a nursing assistant. Answer. C. Allowing the patient to perform ADLs with assistance. Rationale. Allowing the patient to participate in ADLs with assistance promotes independence and preserves dignity. Fully performing the tasks or delegating them completely undermines the patient's abilities. 22. A nurse is planning to help a patient with limited mobility improve their comfort. Which position should be used to promote optimal comfort? A. Trendelenburg position. B. Supine with legs elevated. C. Side-lying position with pillows for support. D. Prone position with head turned to the side. Answer. C. Side-lying position with pillows for support. Rationale. The side-lying position with pillows helps reduce pressure on bony prominences, improving comfort. Trendelenburg and prone positions are not typically used for comfort in immobile patients. 23. A nurse is caring for a patient who is at risk for malnutrition. Which of the following is the priority intervention? A. Start enteral feedings immediately. B. Monitor weight regularly. C. Increase protein and calorie intake. D. Educate the patient about nutrition. Answer. C. Increase protein and calorie intake. Rationale. Increasing protein and calorie intake is essential for addressing malnutrition. Monitoring weight educating the patient, and starting enteral feedings are also important, but follow this primary intervention. 24. A nurse is caring for a patient who reports difficulty sleeping. Which of the following interventions would most likely improve the patient's sleep quality? A. Administer a sleep aid as prescribed. B. Allow the patient to sleep as long as they want during the day. C. Encourage the patient to engage in physical activity during the evening. D. Establish a consistent bedtime routine. Answer. D. Establish a consistent bedtime routine. Rationale. A consistent bedtime routine promotes good sleep hygiene, which improves sleep quality. Physical activity should be encouraged earlier in the day. Sleep aids should be used cautiously and as prescribed. 25. A nurse is preparing to assist a patient with oral hygiene. Which of the following actions is most important? A. Use a soft bristled toothbrush to brush the patient's teeth. B. Use mouthwash before brushing to reduce plaque. C. Encourage the patient to swallow the toothpaste. D. Offer the patient a sugary beverage after brushing. Answer. A. Use a soft bristled toothbrush to brush the patient's teeth. Rationale. A soft bristled toothbrush is gentler on the gums and teeth. Mouthwash should not replace brushing, swallowing toothpaste is unsafe, and sugary beverages can contribute to tooth decay. 26. A nurse is caring for a patient on a liquid diet. Which of the following would the nurse consider a clear liquid? A. Chicken broth. B. Applesauce. C. Milk. D. Gelatin. Answer. A. Chicken broth. Rationale. Clear liquids include items that are transparent and liquid at room temperature, such as chicken broth. Milk and applesauce are not clear liquids. Gelatin is acceptable on a clear liquid diet. 27. A nurse is educating a patient about pain management. Which of the following non-pharmacological interventions should be introduced first? A. Relaxation techniques. B. Transcutaneous electrical nerve stimulation (TENS). C. Cognitive behavioral therapy (CBT). D. Aromatherapy. Answer. A. Relaxation techniques. Rationale. Relaxation techniques are the most accessible and easiest to implement. Other methods like TENS or CBT may require more time and equipment. Aromatherapy may provide additional relief, but is not typically the first-line intervention. 28. A nurse is caring for a patient who is receiving an opioid for pain. What is the priority nursing action when administering this medication? A. Monitor the patient's bowel function. B. Assess the patient's respiratory status. C. Offer the patient a snack. D. Encourage the patient to increase fluid intake. Answer. B. Assess the patient's respiratory status. Rationale. Opioids can depress respiratory function, so assessing respiratory status is the priority action. Bowel function and fluid intake are also important, but are secondary to respiratory monitoring. 29. A nurse is caring for a patient recovering from surgery who is experiencing pain. Which non-pharmacological intervention should the nurse try first? A. Apply a warm compress to the area. B. Offer a relaxation technique, such as guided imagery. C. Give the patient an analgesic medication. D. Suggest the patient take a nap. Answer. B. Offer a relaxation technique, such as guided imagery. Rationale. Non-pharmacological methods like guided imagery can help relieve pain without the use of medication. Applying a warm compress or giving medication may be necessary, but guided imagery is the least invasive option. 30. A nurse is caring for a patient who is confused and disoriented. Which intervention should the nurse prioritize to ensure patient safety? A. Use a bed alarm to prevent falls. B. Administer a sedative to calm the patient. C. Restrict all visitors to reduce stimulation. D. Encourage the patient to rest quietly in bed. Answer. A. Use a bed alarm to prevent falls. Rationale. A bed alarm is the most effective intervention to prevent falls in confused or disoriented patients. Sedatives and restricting visitors may not address the root cause of the disorientation. 31. A nurse is caring for a patient with a cast on the right leg. Which of the following signs indicates the need for immediate intervention? A. Mild swelling around the cast. B. Increased warmth of the cast. C. Tingling sensation in the toes. D. Presence of cracks in the cast. Answer: C. Tingling sensation in the toes. Rationale: tingling in the toes could indicate nerve compression or impaired circulation, which requires immediate intervention. Mild swelling and warmth may be normal, and cracks in the cast are concerning, but not as urgent. 32. A nurse is preparing a patient for discharge after an appendectomy. Which of the following instructions should be prioritized for discharge teaching? A. How to care for the surgical wound. B. The importance of taking antibiotics. C. The need to avoid alcohol consumption. D. How to schedule follow-up appointments. Answer: A. How to care for the surgical wound. Rationale: wound care is a priority to prevent infection post-surgery. While the other instructions are also important, proper wound care takes precedence. 33. A nurse is assisting a patient with limited mobility in transferring from a bed to a wheelchair. What is the best action to prevent injury? Answer: B. Use proper body mechanics when lifting. Rationale: proper body mechanics reduce the risk of injury to both the nurse and the patient. Encouraging the patient to stand first or pivot may increase the risk of falls. 34. A nurse is caring for a patient with a feeding tube. Which of the following interventions should be done before administering tube feeding? A. Flush the tube with water. B. Apply a warm compress to the stomach. C. Check for residual volume. D. Increase the feeding rate slowly. Answer: C. Check for residual volume. Rationale: checking for residual volume ensures that the stomach is empty and can safely tolerate the feeding. Flushing the tube is done after checking residual volume, not before. 35. A nurse is providing care to a patient with a wound that has a thick, yellowish drainage. What type of drainage is this most likely? A. Serous. B. Sanguineous. C. Purulent. D. Serosanguineous. Answer: C. Purulent. Rationale: purulent drainage is thick and may be yellow, green, or brown, often indicating infection. The other types of drainage are typically clear or blood-tinged. 36. A nurse is caring for a patient who has just received pain medication. Which of the following should the nurse assess first? A. The patient's blood pressure. B. The patient's pain level. C. The patient's respiratory rate. D. The patient's level of consciousness. Answer: C. The patient's respiratory rate. Rationale: pain medications, especially opioids, can depress respiratory function, making this the most important assessment. Monitoring blood pressure and pain level are important but secondary. 37. A nurse is teaching a patient about the benefits of a high-fiber diet. Which of the following statements indicates that the patient understands the teaching? A. A high-fiber diet will cure my constipation immediately. B. Fiber helps soften stool and promotes regular bowel movements. C. Fiber can make me feel bloated and constipated. D. I should avoid fiber if I have diarrhea. Answer: B. Fiber helps soften stool and promotes regular bowel movements. Rationale: fiber softens stool and promotes regularity. It does not work immediately, and avoiding fiber for diarrhea is not appropriate. 38. A nurse is caring for a patient recovering from surgery who is unable to eat. Which of the following is the best approach to ensure adequate nutrition? A. Start the patient on a clear liquid diet immediately. B. Begin parenteral nutrition through and for. C. Offer small, frequent meals when tolerated. D. Increase the use of oral supplements. Answer: D. Increase the use of oral supplements. Rationale: oral supplements provide additional calories and nutrients when the patient is unable to consume solid food. Starting clear liquids or parenteral nutrition should be done only if needed. 39. A nurse is caring for a patient with a wound infection. Which of the following is a priority intervention? A. Apply a sterile dressing to the wound. B. Administer prescribed antibiotics. C. Encourage the patient to rest. D. Assess the patient's vital signs. Answer: B. Administer prescribed antibiotics. Rationale: administering antibiotics is essential to treat the infection. While the other interventions are important, antibiotic therapy is the first priority in wound infection management. 40. A nurse is providing oral care for an unconscious patient. Which of the following interventions should be prioritized? 8. Position the patient in a lateral position. B. Suction the patient's oral cavity. C. Use a soft toothbrush to clean teeth. D. Provide mouthwash to the patient. Answer. H. Position the patient in a lateral position. Rationale. Positioning the patient laterally helps prevent aspiration of secretions. Suctioning may be needed, but the priority is ensuring the patient is positioned safely. 41. A nurse is preparing a patient for a shower. Which of the following interventions is most important to prevent falls during the shower? A. Place a rubber mat in the bathtub. B. Encourage the patient to shower alone. C. Assist the patient by standing behind them. D. Ensure the patient has a walker in the bathroom. Answer. A. Place a rubber mat in the bathtub. Rationale. A rubber mat in the bathtub is essential for fall prevention, as it provides traction. Assistance may be necessary, but preventing slippery surfaces is the first step. 42. A nurse is caring for a patient who is at risk for skin breakdown. Which of the following interventions would be most effective in preventing pressure ulcers? A. Reposition the patient every 4 hours. B. Keep the skin dry and clean. C. Massage bony prominences. D. Provide the patient with a soft mattress. Answer. B. Keep the skin dry and clean. Rationale. Keeping the skin dry and clean prevents moisture-related breakdown. Repositioning is important, but keeping skin free from moisture is critical for prevention. 43. A nurse is educating a patient with diabetes about proper foot care. Which of the following instructions should the nurse include? A. Soak your feet daily in warm water. B. Wear tight-fitting shoes to prevent blisters. C. Inspect your feet daily for cuts or sores. D. Avoid moisturizing your feet to prevent infection. Answer. C. Inspect your feet daily for cuts or sores. Rationale. Daily foot inspection helps identify issues early, preventing complications. Soaking feet, tight shoes, and avoiding moisturizers can contribute to injury and infection. 44. A nurse is caring for a patient who is receiving intravenous for fluids. What should the nurse assess first to ensure the FOR is functioning properly? A. The patient's vital signs. B. The FOR insertion site for redness or swelling. C. The flow rate of the FOR fluids. D. The patient's urine output. Answer. B. The FOR insertion site for redness or swelling. Rationale. Checking the insertion site for complications like infiltration or infection is the priority. Ensuring the FOR is working properly comes next. 45. A nurse is caring for a patient with a surgical wound that is healing by secondary intention. Which of the following is the most appropriate dressing? A. Dry sterile dressing. B. Wet to dry dressing. C. Hydrocolloid dressing. D. Transparent film dressing. Answer. B. Wet to dry dressing. Rationale. Wet to dry dressings are used to promote granulation and debridement in wounds healing by secondary intention. Other dressings may not effectively promote this process. 46. A nurse is educating a patient on how to perform perineal care. Which of the following is the correct technique? A. Clean from the back to the front. B. Use soap and hot water to cleanse the area. C. Clean from the front to the back. D. Rinse with alcohol to cleanse the area. Answer. C. Clean from the front to the back. Rationale. Cleaning from front to back reduces the risk of urinary tract infections. The other techniques could introduce bacteria from the rectum to the urinary tract. 47. A nurse is caring for a patient with fluid volume overload. Which of the following is the most important intervention? A. Restrict fluids. B. Increase the patient's sodium intake. C. Elevate the patient's legs. D. Monitor the patient's respiratory rate. Answer. A. Restrict fluids. Rationale. Fluid restriction is essential to manage fluid volume overload. Monitoring respiratory rate and elevating legs are helpful, but fluid restriction is the priority. 48. A nurse is caring for a patient with pneumonia. Which of the following is the most important nursing intervention? A. Administer oxygen as prescribed. B. Provide pain medication for chest pain. C. Increase the patient's fluid intake. D. Assist the patient with deep breathing exercises. Answer. D. Assist the patient with deep breathing exercises. Rationale. Deep breathing exercises help improve lung expansion and prevent atelectasis. Administering oxygen and increasing fluid intake are also important, but deep breathing exercises are the priority for improving respiratory function. 49. A nurse is caring for a patient with a history of falls. Which of the following interventions is most effective in preventing future falls? A. Use a gait belt when assisting the patient. B. Keep the patient in bed at all times. C. Provide the patient with a walker. D. Keep the lights dim to promote rest. Answer. A. Use a gait belt when assisting the patient. Rationale. A gait belt provides added security when helping a patient with mobility, reducing the risk of falls. Other measures like walkers are important, but using a gait belt is the most effective for assistance. 50. A nurse is caring for a patient with a urinary catheter. Which of the following is the most important intervention to prevent a urinary tract infection? A. Secure the catheter properly. B. Empty the catheter bag when it is half full. C. Keep the catheter bag above the level of the bladder. D. Clean the catheter with antiseptic solution. Answer. A. Secure the catheter properly. Rationale. Securing the catheter prevents tension and reduces the risk of infection. Proper drainage is also important, but securing the catheter is the priority to prevent movement that could introduce bacteria. 51. A nurse is caring for a patient with a pressure ulcer. Which of the following interventions is most effective for promoting wound healing? A. Massage the ulcer with lotion. B. Apply a wet-to-dry dressing. C. Keep the wound dry and free from moisture. D. Elevate the ulcer above the heart level. Answer. B. Apply a wet-to-dry dressing. Rationale. Wet-to-dry dressings promote granulation and assist with debridement. Keeping the wound dry could delay healing in some cases, and massaging the ulcer could cause tissue damage. 52. A nurse is caring for a patient with chronic pain. Which of the following should the nurse assess first to guide pain management? A. Pain intensity using a pain scale. B. The patient's coping mechanisms. C. The effectiveness of previous pain treatments. D. The patient's vital signs. Answer. A. The pain intensity using a pain scale. Rationale. Assessing the pain intensity is the first step to determine appropriate pain management. Coping mechanisms and previous treatments are important, but come after initial pain assessment. 53. A nurse is caring for a patient with a hip replacement. Which of the following should be included in the care plan to prevent dislocation of the hip? A. Have the patient avoid bending the hip beyond 90 degrees. B. Encourage the patient to sleep on the affected side. C. Allow the patient to sit in low chairs. D. Encourage the patient to cross their legs. Answer. A. Have the patient avoid bending the hip beyond 90 degrees. Rationale. Avoiding excessive hip flexion is essential to prevent dislocation after hip replacement. The other actions increase the risk of dislocation. 54. A nurse is caring for a patient who is experiencing nausea and vomiting. Which of the following interventions should the nurse prioritize? A. Administer antiemetic medication. B. Offer small sips of clear fluids. C. Position the patient in a high Fowler's position. D. Provide a cold compress to the patient's forehead. Answer. A. Administer antiemetic medication. Rationale. Administering antiemetic medication is the priority to control nausea and vomiting. While offering fluids and other comfort measures are helpful, controlling the symptoms is most important. 55. A nurse is caring for a patient who is having difficulty breathing. Which of the following should the nurse do first to improve the patient's respiratory status? A. Provide oxygen via nasal cannula. B. Encourage deep breathing exercises. C. Administer a bronchodilator. D. Raise the head of the bed. Answer. D. Raise the head of the bed. Rationale. Elevating the head of the bed helps improve lung expansion and promotes easier breathing. Oxygen and other interventions are important, but positioning is the first step to relieve dyspnea. 56. A nurse is caring for a patient with dehydration. Which of the following interventions is most important to restore fluid balance? A. Encourage the patient to drink water frequently. B. Administer intravenous fluids as prescribed. C. Monitor the patient's electrolyte levels. D. Provide the patient with salty snacks. Answer. B. Administer intravenous fluids as prescribed. Rationale. Intravenous fluids are the quickest way to restore fluid balance in a dehydrated patient, especially if oral intake is not sufficient. Monitoring electrolytes and encouraging fluid intake are also important. 57. A nurse is caring for a patient with a history of falls. Which of the following interventions is most effective in preventing future falls? A. Use a bed alarm system. B. Ensure the patient wears non-slip socks. C. Keep the environment clutter-free. D. Educate the patient about fall prevention. Answer. C. Keep the environment clutter-free. Rationale. A clutter-free environment reduces the risk of tripping and falling. While other interventions are useful, environmental safety is crucial for preventing falls. 58. A nurse is educating a patient on how to manage constipation. Which of the following should be included in the teaching? A. Avoid high-fiber foods. B. Drink plenty of fluids and exercise regularly. C. Take laxatives regularly. D. Limit physical activity to reduce strain. Answer. B. Drink plenty of fluids and exercise regularly. Rationale. Drinking fluids and regular exercise help promote bowel movement. High-fiber foods are beneficial for managing constipation, and overuse of laxatives should be avoided. 59. A nurse is caring for a patient who is post-op and experiencing pain. The patient is requesting pain relief. Which of the following is the first action the nurse should take? A. Administer the prescribed pain medication. B. Assess the patient's pain level. C. Provide a warm compress to the area. D. Encourage the patient to relax and breathe deeply. Answer. B. Assess the patient's pain level. Rationale. Assessing the pain level is the first step to determine the appropriate action for pain management. After assessment, medication or other interventions can be provided. 60. A nurse is caring for a patient with a nasogastric NG tube. Which of the following is most important for preventing complications related to the NG tube? A. Position the patient upright during feeding. B. Flush the NG tube every 4 hours. C. Change the NG tube every 24 hours. D. Secure the NG tube to the patient's nose. Answer. A. Position the patient upright during feeding. Rationale. Keeping the patient upright during feeding reduces the risk of aspiration. Flushing the NG tube and securing it are important but not as crucial in preventing complications as positioning. 61. A nurse is assisting a patient with early-stage dementia in performing personal hygiene. Which of the following strategies is most helpful? A. Use clear and simple instructions. B. Allow the patient to bathe independently. C. Perform all tasks for the patient. D. Limit the time for hygiene tasks. Answer. A. Use clear and simple instructions. Rationale. Using clear instructions helps the patient understand and engage in personal hygiene. Providing too much assistance or rushing the patient may cause frustration. 62. A nurse is caring for a patient with an acute migraine headache. Which of the following interventions is most effective for pain relief? A. Administer analgesics as prescribed. B. Provide a quiet, dark environment. C. Apply a cold compress to the patient's forehead. D. Offer the patient a light snack. Answer. B. Provide a quiet, dark environment. Rationale. A quiet, dark environment reduces stimuli that can worsen migraine pain. While medication and cold compresses may help, a calm environment is a priority. 63. A nurse is caring for a patient who is at risk for aspiration. Which of the following is the most effective way to reduce this risk during meals? A. Position the patient in a semi-Fowler's position. B. Provide the patient with small, frequent bites. C. Offer thickened liquids. D. Place the patient on a soft diet. Answer. H. Position the patient in a semi-Fowler's position. Rationale. The semi-Fowler's position minimizes the risk of aspiration during meals. Thickened liquids and small bites are helpful, but positioning is the most important factor in reducing aspiration risk. 64. A nurse is educating a patient with a new colostomy on how to care for the stoma. Which of the following statements indicates understanding? A. I should change the pouch only when it is full. B. I will clean the stoma with soap and water. C. I will apply a new pouch every 3 to 4 days. D. I should avoid all physical activity after surgery. Answer. C. I will apply a new pouch every 3 to 4 days. Rationale. The pouch should be changed regularly to maintain hygiene and prevent leaks. Cleaning with soap and water is not recommended due to potential irritation. 65. A nurse is caring for a patient with an indwelling urinary catheter. Which of the following actions helps prevent a urinary tract infection (UTI)? A. Use a sterile technique when changing the catheter. B. Clamp the catheter after each use. C. Ensure the catheter is properly secured to prevent tension. D. Empty the drainage bag every 12 hours. Answer. C. Ensure the catheter is properly secured to prevent tension. Rationale. Securing the catheter properly prevents movement, reducing the risk of infection and injury. Sterile technique and regular bag emptying are also essential, but securing the catheter is crucial to preventing tension. 66. A nurse is caring for a patient who is recovering from surgery and experiencing pain. Which of the following should the nurse do to promote comfort? A. Administer prescribed pain medications on a regular schedule. B. Encourage the patient to use deep breathing exercises only. C. Suggest the patient wait to take medication until the pain becomes severe. D. Restrict movement to avoid further pain. Answer. A. Administer prescribed pain medications on a regular schedule. Rationale. Regular administration of pain medication ensures better pain control and comfort. Deep breathing and waiting for pain to worsen are not effective strategies for managing pain. 67. A nurse is educating a patient with heart failure about fluid restrictions. Which of the following should the nurse include in the teaching? A. Drink 8 cups of water daily. B. Limit fluid intake to 2 liters per day. C. Drink only during meals. D. Avoid all fluids in the evening. Answer. B. Limit fluid intake to 2 liters per day. Rationale. Fluid restriction is essential in heart failure to prevent fluid overload. The recommended intake is typically around 2 liters per day. 68. A nurse is caring for a patient who is post-op and at risk for deep vein thrombosis, DVT. Which of the following is the best intervention to reduce this risk? A. Encourage the patient to perform leg exercises. B. Administer anticoagulants as prescribed. C. Keep the patient in a flat position. D. Apply ice packs to the legs. Answer. A. Encourage the patient to perform leg exercises. Rationale. Leg exercises help increase circulation and reduce the risk of DVT. While anticoagulants and other interventions are important, exercises are the most effective for promoting circulation. 69. A nurse is caring for a patient with a nasogastric tube. Which of the following is the most important intervention to maintain tube patency? A. Flush the tube with water regularly. B. Change the tube every 24 hours. C. Provide the patient with oral hygiene frequently. D. Secure the tube to the patient's nose. Answer. A. Flush the tube with water regularly. Rationale. Regular flushing prevents blockages and maintains patency. Changing the tube or providing oral hygiene are secondary interventions. 70. A nurse is caring for a patient who has received an opioid analgesic. Which of the following is the most important assessment after medication administration? A. Pain level. B. Level of consciousness. C. Respiratory rate. D. Urinary output. Answer. C. Respiratory rate. Rationale. Opioids can depress respiratory function, making it essential to monitor the patient's respiratory rate. Other assessments, such as pain level and consciousness, are also important but secondary. 71. A nurse is caring for a patient with impaired mobility. Which of the following is the most effective way to prevent complications from immobility? A. Encourage the patient to exercise regularly. B. Perform passive range of motion exercises. C. Use pressure-relieving devices. D. Provide the patient with a high-protein diet. Answer. B. Perform passive range of motion exercises. Rationale. Passive range of motion exercises help maintain joint mobility, reduce stiffness, and prevent complications of immobility, such as contractures and muscle atrophy. 72. A nurse is providing discharge teaching to a patient who recently underwent a hip replacement. Which of the following instructions is most important? A. Avoid using a walker for support. B. Do not bend the hip beyond 90 degrees. C. Perform weight-bearing exercises immediately. D. Sleep on the affected side. Answer. B. Do not bend the hip beyond 90 degrees. Rationale. Preventing excessive hip flexion is crucial to avoid dislocation after hip replacement surgery. Other instructions, like using a walker, are important but secondary. 73. A nurse is caring for a patient who is having difficulty swallowing. Which of the following actions is most appropriate? A. Offer thin liquids to the patient. B. Place the patient in a high Fowler's position. C. Encourage the patient to eat soft, chewy foods. D. Feed the patient in a reclining position. Answer. B. Place the patient in a high Fowler's position. Rationale. Placing the patient in a high Fowler's position helps reduce the risk of aspiration during swallowing. Offering thin liquids may increase aspiration risk. 74. A nurse is caring for a patient with nausea. Which of the following non-pharmacological interventions is most likely to alleviate nausea? A. Encourage the patient to drink coffee. B. Provide the patient with a cool compress on the forehead. C. Have the patient eat solid foods immediately. D. Ask the patient to lie flat in bed. Answer. B. Provide the patient with a cool compress on the forehead. Rationale. A cool compress on the forehead may help reduce nausea. Other interventions, like drinking coffee or eating immediately, may worsen the symptoms. 75. A nurse is educating a patient on the importance of fluid intake. Which of the following statements by the patient indicates understanding? A. I will only drink fluids when I am thirsty. B. I should drink at least 8 cups of fluid each day. C. I should avoid all fluids if I am on a low-sodium diet. D. Drinking too much fluid can cause dehydration. Answer. B. I should drink at least 8 cups of fluid each day. Rationale. Proper hydration is essential for maintaining body functions, and 8 cups of fluids daily is a general guideline. Drinking only when thirsty may not ensure adequate intake. 76. A nurse is providing care for a patient with a urinary tract infection (UTI). Which of the following interventions is most important? A. Administer prescribed antibiotics. B. Encourage fluid intake. C. Provide pain medication. D. Teach the patient to void frequently. Answer. A. Administer prescribed antibiotics. Rationale. Antibiotics are the most important treatment for UTIs. While encouraging fluids, providing pain relief, and teaching good hygiene are helpful, antibiotics are the priority to treat the infection. 77. A nurse is caring for a patient with an indwelling urinary catheter. Which of the following is the most important intervention to prevent infection? A. Ensure the catheter is secured properly. B. Empty the catheter bag every 12 hours. C. Maintain a closed system for the catheter. D. Change the catheter daily. Answer. C. Maintain a closed system for the catheter. Rationale. Maintaining a closed system reduces the risk of contamination and infection. Proper securing and regular emptying are important, but secondary to maintaining a closed system. 78. A nurse is teaching a patient with a new colostomy how to care for the stoma. Which of the following should the nurse emphasize? A. Apply a new pouch every 3 to 4 days. B. Clean the stoma with soap and water. C. Avoid foods that cause gas. D. Change the pouch only when it leaks. Answer. A. Apply a new pouch every 3 to 4 days. Rationale. A new pouch should be applied regularly every 3 to 4 days, or as needed to prevent leaks. Soap and water should be avoided for cleaning the stoma, and foods that cause gas should be monitored. 79. A nurse is caring for a patient recovering from a stroke. Which of the following interventions should be prioritized to prevent complications? A. Encourage the patient to perform hand exercises. B. To perform passive range of motion exercises. C. Position the patient to prevent aspiration. D. Encourage the patient to sit up in a chair. Answer. C. Position the patient to prevent aspiration. Rationale. Aspiration is a serious risk for stroke patients, and proper positioning helps prevent it. While other interventions may help with rehabilitation, preventing aspiration is the priority. 80. A nurse is caring for a patient with a spinal cord injury. Which of the following interventions should be prioritized to prevent skin breakdown? A. Apply topical ointments to dry skin. B. Reposition the patient every 2 hours. C. Massage bony prominences to improve circulation. D. Provide the patient with a soft mattress. Answer. B. Reposition the patient every 2 hours. Rationale. Repositioning every 2 hours prevents pressure ulcers by reducing the pressure on bony prominences. Applying ointments and massages are helpful, but repositioning is the key intervention.